Hi everyone, in this video we'll discuss about the basic ocular pharmacology. So let's start with the pharmacodynamics. Pharmacodynamics is the biological and therapeutic effect of the drug. That is, how the drug mechanisms of action occurs. To start the mechanism, the drug should bind to the micromolecules like neurotransmitters, hormonal receptors or enzymes. When the drug binds to the receptors, it has either an agonist or an antagonist effect, and when the drug binds to an enzyme, it has an activator or an inhibitor effect. Secondly, pharmacokinetics. Pharmacokinetics is the mechanism how the drug is taken to the body. It can be explained in three alphabets A, D, E, M. A stands for the absorption of the drug, D stands for the distribution of the drug, M stands for the metabolism of drug, and E stands for the excretions of drug. Now, the routes of drug administration to the ocular tissue can be local or systemic route. The local route includes topical route, periocular route, and the intraocular route, whereas the systemic route includes oral route, intravenous routes, and intramuscular routes. Topical can be applied directly to the anterior of the globe in the form of eye drops, eye ointments, and eye gel. Periocular have subconjunctival route, subtenon route, and peribulbar or retrobulbar route. These are used when the penetration of topical drug is not enough. For example, during the applications of anesthesia. Intraocular have intracameral and intravitreal route. For example, intracameral route is used in case of cataract surgery and intravitreal route is used in case of injecting anti-VEGF injection in case of diabetic retinopathy. Now, advanced way is the sustained release devices for steady state delivery of drug. For example, Timoptic delivering the timolol in case of glaucoma. Now, let's take some questions. Questions number 1. Which topical drug should be applied first, the drops or an ointment? The answer is drop. The drop should be applied first, then the ointment. Because if the ointment applied first, then this may cause reductions in the drop penetrations because of the ointment higher viscosity level. So the second question is, how much time difference should be given between the two drops? The answer is 10 to 15 minutes should be given between the two drops because the conjunctival sac has the capacity of 7.13 microliters, whereas the one drop of drug has 50 microliters. So if you apply the second drop immediately, it will replace the first drop before complete penetration takes place. So now let's talk about the drug concentration and solubility. So the more drug concentration, the higher the penetrations. For example, the pilocarpine, which is available from 1 to 4% concentration, pilocarpine with the 4% concentration has higher penetrations. Solubility of drug depends on the drug lipid and water solubility because epithelium and endothelium of the cornea allows drug penetration, which is lipid soluble, and the stroma allows drug which is water soluble. So the drug which has higher lipid and water solubility has higher penetrations. If we talk about the viscosity, it's very important because higher viscosity, the more time contact with the ocular surface leads to the higher penetration. That's why methyl cellulose or polyvinyl alcohol are added to increase the viscosity level. Usually the pH of care is 7.4, but if the drug pH is different from 7.4, it leads to the irritations and stinging sensation, which releases reflex tear. Surfactants, preservatives like benzoconium can alter the cell membranes in cornea and increase the penetrations. In drug tonicity, when alcoholate drug is added to the ocular drug without changing the form, it can increase the penetrations. Thank you everyone for the basic ocular pharmacology part 1.